Okay, we're going to go ahead and get started. I wanted to welcome everybody to this session. This is the Didactic Pathways to Pediatric Emergency Medicine, sponsored by the Pediatric Emergency Medicine Interest Group. And I wanted to particularly welcome our two speakers, Dr. Jennifer Mitzman, faculty at The Ohio State University Wexner Medical Center, as well as Nationwide Children's, and Dr. Michael Kim at the University of Wisconsin School of Medicine and Public Health, who's the medical director of Pediatric EMS and co-chair of Wisconsin Emergency Medical Services for Children. Very excited to welcome both of you, and I will let you take the floor.
Thanks. We're very happy to have all of you here, and today we are going to talk about the pathways to pediatric emergency medicine, talk about some resources for how to find fellowships that kind of coincide with your desired pathway, and to think about how to analyze your own career goals and their alignment with the two different pathways. So first, we just kind of like to introduce ourselves and share the pathway that we each have taken. So I am Jennifer Mitzman. I am an emergency medicine trained physician first, followed by a pediatric emergency medicine fellowship. I did those in Cleveland and in Winston-Salem, respectively. And then I've been on the faculty at The Ohio State University for 7 years. I do 50-50 split. So I see adults half the time, children the other half of the time, but never in the same shift or mixed together because of our setup. And then I do, in addition to clinical work, I have about 50% of my time is academic, serving as the Associate Fellowship Director for our PEM Fellowship, the lead Peds educator for our EM residency, and doing some curriculum research in medical education.
Wow, good morning. Hi, Michael Kim from University of Wisconsin. I am a pediatric trained person in pediatric emergency medicine, and I did my residency at University of Chicago when it used to be called Weiler Children's. And then I did my fellowship at Medical College of Wisconsin years ago. And I was at Medical College for a number of years until I came to University of Wisconsin about 13 years ago. And in my role here currently, I'm an associate professor in EM and Pediatrics. And I'm currently, as Dr. Carroll mentioned, I'm a director for Pediatric EMS, and I'm also sort of chairing the promotions committee for the department, which is very critical for faculty mentorship. So we can start. Okay, so we will talk about a couple of different ways to get to pediatric emergency medicine career. Specifically, we will talk about pediatric emergency medicine through pediatric residency, PM fellowship, and also emergency medicine residency and PM fellowship, which can vary in a couple of different number of years. Then there's another way to practice pediatric emergency medicine, but not board certified. So that is a combined residency in pediatric and emergency medicine. There are 4 programs that provide this program, but that you're not eligible for board certification in pediatric emergency medicine if you do the 5-year combined residency. But we will not discuss this specifically in this session. So if you choose to go through the emergency pediatric residency and pediatric emergency medicine fellowship, you will need to have a complete 3-year pediatric residency. And the focus of this during this pediatric residency is to get you really able to have a comprehensive care for a machine called child. That includes preventative medicine, acute care, along with ongoing interventions in a longitudinal fashion. And many pediatric residencies have slightly different curriculum, but generally they include emergency department rotations are usually 1 month per year, so about 3 months total. And then inpatient rotations that may comprise up to 5 to 10 months of a total of 3 years. And then many subspecialty rotations that are critical, such as cardiology, infectious disease, and nephrology, et cetera. And then throwing a smattering of acute care or urgent care clinics. And I think this is one of the most important things that emergency medicine route does not address is a newborn medicine. So I think I've seen a lot of my residents who have really not accustomed to taking care of newborn babies unless they have one of their own. So newborn medicine is a critical part of emergency pediatric residency. And I think that really that route pathway provides a significant foundation for newborn babies. And also you go through pediatric intensive care unit and other growth and developmental areas such as adolescent medicine. And then in 3 years of residency, you will have a continuity care clinic that spans over 3 years as well. So after the 3 years of pediatric residency training, you'll be able to really provide a thorough care for pediatric patients. Then if you match onto a pediatric emergency medicine fellowship, then it's slightly different than the EM residency route. So this is a model curriculum from Children's Hospital of Philadelphia, CHOP. A typical pediatric track in pediatric emergency medicine really emphasizes you to really become a clinical education in becoming a pediatric well-oiled machine in emergency department. So because the pediatric does not have a lot of emergency medicine experience, so the fellowship really trains you to become that well-oiled machine in the emergency department, moving a lot of patients with many different patients on your hand. The rotations do include an ample amount of ED rotations, but clinically experienced, and they go through some essential subspecialties such as trauma, anesthesiology, at least 2 months of adult medicine that is included in the fellowship. So what's interesting about the pediatric residency pathway is that the third year, or the American Board of Pediatrics, does emphasize significantly on the academic portion of your fellowship. So research and scholarly achievements are quite a significant portion of your fellowship. And they spend the last 3 years in really including finishing your academic projects, advanced degree, or even national presentation is the focus of your third year of your fellowship. So some of the advantages, there are some, we're not going to do a hand-to-hand comparison between the two, but some of the distinct advantages of pediatric residency and PEM fellowship include a solid and complete foundation for caring for a child as a whole comprehensive human being. And there's a strong emphasis on training for academics or research-focused PEM career. And the third year, definitely advanced degrees such as master's in education or biostatistics, or any other pertinent subspecialty field that you're interested in. And some of the disadvantages that we would mention, it depends on the career path that you choose. But a few of the disadvantages include a total 6 years of total training, but you can actually do 7 years of training in EM-PEM fellowship. You can, I think Dr. Mitzman will go through this in a few minutes. There is also a potential compensation differential because the pediatric specialty sometimes gets a little less of a compensation compared to the EM. So that may be an issue when you become a faculty. And over the 15 years of the last 15 years, the pediatric emergency medicine job opportunities have really exploded significantly in community setting as well. So I think it's not as much of a problem than it was 15, 20 years ago, but still the job opportunities, because you cannot see an adult emergency medicine patient, you may be slightly restricted in getting a job opportunity.
So now I'd like to transition to talking a little bit about the emergency medicine pathway. So of course, for an emergency medicine residency training, you spend a significant amount of time in the emergency department, generally about 18 of your 36 months. And then you spend a lot of time in places that end in U. So MICU, PICU, SICU, trauma ICU, cardiac ICU, right? And so I think one of the advantages for an EM resident is that they do come into fellowship with significant procedural and critical care skills and assessments. What they don't have necessarily is a lot of pediatric experience, or they will spend some time seeing pediatric emergency patients. Depending on the residency program, those may be integrated into the general in the general ED in which they are practicing, or augmented with some PEM experience at a kind of partner site. Certainly EM residents do have some electives, and if you know that you're interested in pediatric emergency medicine, using some of that elective time to round out pediatric experiences, including things like newborns, or being in the delivery room on the ped side, or things like that, because as Dr. Kim mentioned, we do see a lot of very young children in the Peds ED, and sometimes our EM training does not provide us with nearly the level of comfort with some of those patients. In terms of the fellowship curriculum, this is a sample. This is ours at Nationwide. The requirements are relatively sparse in terms of what is absolutely required. At least 4 months in pediatrics that have to be outpatient, and 2 of which have to be outpatient, and 2 critical care that are not part of the Peds ED must be included. Research is not required on the EM pathway because it is required at the residency level, but there are many programs that require scholarly activity. And so that's definitely something to ask on the interview trail and to kind of suss out, especially if you either love research or it's not your jam. In the 2020 ACGME requirements, it was outlined that PEM fellowships must have a separate 2-year curriculum for EM trainees. They can't just, the days of sort of like, well, we just offer a 3-year and this is what you'll do with a few modifications, did fall out of those requirements. Obviously, programs will have a period of time to get in compliance, but I would expect if you are on the EM pathway to see more and more 2-year options available as you start to look. In terms of advantages and disadvantages, so in general, it's going to be 5 years of training. Now, there are some 4-year programs out there for EM, and there are some 3-year PEM opportunities for EM as well. So, you could make it 7 if you really have that burning desire to be a trainee for some extra time. But in general, it's going to be 5. In terms of the job market, obviously there's a lot of different career opportunities. Being versatile, able to see patients of all ages, in addition to kind of offering some combined options in the academic world, of course, open up lots of opportunities in the community world. PEM has an ever-growing, burgeoning presence in the community. And so that EM-PEM opportunities in the community have, of course, grown as well. Disadvantages, we talked about the primary one, which is just that you're not going to go in as comfortable with children. And so even though the pacing and some of those sort of ED doc things will come naturally to an EM trained physician in the PZD, there's some catching up to be done on the pediatric fundamentals for sure. So why did we do this? Michael, you want to share first?
Oh, sure, absolutely. So why did I come into emergency medicine, pediatric emergency medicine? So I did graduate from Peds residency. I was in practice for 3 years, and I found that primary care practice was, don't tell anyone, but it was pretty boring for me. After being at University of Chicago with tertiary care, learning all the skills of, so I started moonlighting at Northwestern Children's Memorial, and then I realized that because I was general Peds person, I couldn't see the acute or the very sick kids. So I said, well, tough, I'm gonna go and get my fellowship. So when I got the fellowship to really get that experience of being able to take care of sick kids, I was really excited to do all the skills, procedures, etc. I got my fill, but over the decades of sort of working, and I found a different calling. And I found that how anxious, frightened, and panic-stricken family and kids are. And I feel like I came to this sort of understanding that I was able to provide the reassurance and the ability to really calm the panic-stricken family and kids, to see that they are being calmed and they're able to know that their kids will be fine. So I think that for me, that has grown over the years to really cherish that ability to be able to calm patients down and really take care of the patient. In addition to medical care, has been the most important thing that I feel like enjoying at this point in my career.
That's awesome. And I think for me, a couple of drivers. One was the variety. It's not surprising that someone who did emergency medicine liked a little bit of all the things. And that was true of me as well. I did a PEM rotation as a 4th-year medical student and really loved it. So I had the fortune of kind of going into EM residency all along, sort of knowing like this might be something I was interested in, which helped me to explore it earlier than I might have otherwise. But I like the chance to kind of go back and forth to see some different pathology and, really kind of see everybody from, birth to death. And I enjoy that. And the other big driver for me, I was a teacher before medical school, and I knew that I was very interested in medical education. And I felt like there was a growing presence in PEM from emergency medicine physicians. And so having a chance to work educationally in that space was something that was really appealing to me as well. So how do you find where you want to be? So ERAS is the primary. We are a match, so you'll have a second match. ERAS does maintain lists. I will tell you that check out both lists regardless of your training programs. I was a little embarrassed that even my own, we're trying to fix this before next match, was not cross-listed in both, even though we have a long history of taking residents from both training pathways. So no matter which one you are, look in both and look at the individual program websites because there are more and more programs that are interested in having a blend of learners. Some other ways to kind of find out information, the Pediatric EM committee from EMRA has a lot of blog posts. They have a really fun virtual escape room and a number of podcasts kind of about PEM. EMRA does maintain a fellowship list. It is not as complete as ERAS and still sort of being built out, but it does have some of the information from your kind of peer-to-peer, like moonlighting opportunities, how many shifts a month, some of that stuff that you may not find as easily on a website, but want to know when making your decisions. And the EMRA Fellowship Guide also, of course, dedicates a section to the Pediatric Emergency Medicine Fellowship.
Okay, so it's my part now. So in considering a Pediatric Emergency Medicine Fellowship, there are a handful of issues that I think you should strongly consider. A lot of these have been mentioned already, but I'd like to just highlight different pathways are distinct for different programs, but there are a lot of programs that to take both pathways. So make sure you know which one you go with, because there are some perceptions that may be of an importance to you. Also consider the size of the program. Do you want to see a mega experience such as nationwide, 100,000 per year, or 15,000 or 20,000 at least in our program too? So something you want to know. Also the patient's significant characteristics such as socioeconomic issues or diversity issues. Those may be of an important issue. The next is the most important issue, I think, is availability of qualified faculty. And then I cannot stress enough finding a mentor that could really guide you through your fellowship. That has made me survive the fellowship and be able to become a clinician that I am. So finding the faculty and the mentorship is critically important. And then the other is availability of any optional subspecialty advanced degree if they're available, and the stability of the program, obviously. Besides the curriculum itself, I think it'd be important to know your clinical responsibility versus teaching responsibility or admin responsibility. These are all looped into your fellowship, distinctly separating those three and asking questions about what your responsibilities are going to be important in really finding the fellowship that you're looking for. And then scholarly activity requirements are somewhat different, is very vague, but I think clearly understanding what the requirements are for you to obtain that ability to get board certified is very, very important. Level of supervision or clinical autonomy. Can you run the ED by yourself during your second year or third year? These differ from programs too, so you wanna know that. And then trauma operations, meaning trauma service and the Peds or the Pediatric Emergency Medicine. A lot of programs have a different interrelationship with trauma service, so that's something that is very important for you to know. And then the other thing that I really think is important is really know the outcomes of the fellowship program, meaning what kind of scholarly activities, publications, grants, etc., has the fellows produced over the years. That's an important thing if you really want to take a stab at the academics and how their output has been. And then some of the things that we mentioned already, moonlighting, the combination of adult shift. If you go through the EM residency, you need to know how much of EM shift you can or you will do. I've had some fellows who actually fall out of fellowship because of these conflicts. So these are important stuff to mention.
And lastly, you don't have to take our word for it. This is a study that was done in the BMC Health Services Research. They asked about job satisfaction, and they didn't just group, all of peds, all of surgery, but really broke it down by specialty. And there we are right at the top. So you don't have to just believe Michael and I that we have that pediatric emergency medicine is the best. You have even some data to support how happy we are in our career choices. So at this point, we're happy to stop screen sharing and see if there are any questions. And then we also have our email addresses up there if there's any questions after the session as well.
Thank you, Michael and Jennifer, so much. And I wanted to ask one question, and that's with regard to education. So Dr. Mitzman, you had mentioned that education is very important to you, but particularly like the pediatric component to the EM residency.
Yes.
Can you talk about that?
Sure. So, I think that one of the things I noticed, and again, I came in with that sort of educational lens, was that when I was training, a lot of the pediatric emergency medicine physicians were pediatricians. And at that time, there wasn't as much presence of PEM in the community. And there wasn't as much presence for EM on the EM to PEM pathway. And so some of the way that we have the luxury of doing things when we're in the mega children's hospital, ivory tower, resource and rich environments don't translate as easily for EM physicians in the community or more PEM physicians in the community. And there's many more of those than there were at that time. So, to me, developing curricula, making sure that people feel very grounded in their procedural skills and things like that as they branch out to practice pediatric emergency medicine in places that don't have as many resources, as well as to make sure that our EM physicians feel comfortable with children, because, we know from other much more important researchers than I am, that 90% of children are going to be seen first by a general EM and first in a general emergency department. So.
And I know that we're past the hour. Does anybody have any question for either Dr. Kim or Dr. Mitzman? And you could put it in the chat or.
I do have a question about the combined Peds EM training. How likely is it that you could work in an actual children's hospital with that training instead of going the fellowship route?
That's a great question. Because there only have a handful of combined residency programs, and depending on the hospital, do they require board certification or not? Looking back, I think you could practice pediatric emergency medicine perfectly well without board certification. But if your hospital or your medical school is requiring board certification, that would be a big issue. I mean, you could practice wherever you want, but board certification, if that's an issue, that would be of a significant issue.
Yeah. So I will say at children's, we hired our first one ever this year. I think we would be open to hiring more, but we, certainly ourselves have like a pretty long history of not utilizing those physicians. And what I tend to observe is that many of them are sort of stay clustered locally to those programs, meaning, those 4 programs keep a lot of their own faculty and of course allow them to see the patients they feel that they have trained them to see, and they're sort of near reach referring places. They're very popular because of their dual training. So if you train at the IU program, you're going to have lots of opportunities in the state of Indiana because they feel very comfortable, and those physicians are very marketable. I do think that kind of right or wrong or fair or unfair in some of the sort of bigger tertiary or quaternary care hospitals, that there is a push to have pediatric emergency medicine trained physicians, and that the absence of board eligibility or like a an availability of taking the test and testing in can be a hindrance in some of those bigger cities.
Thank you.
You're welcome.
We can take one more question.
Hi, I had a question. So I am starting EM residency in July, and I was just wondering, in terms of going into EM residency with the feeling of, hopefully going on to PEM fellowship, do you have any suggestions in terms of how to orient your sort of study or your electives or anything like that that you might suggest?
So that's great. I always love to hear about people who are thinking about the EM to PEM pathway. I would, share that with people for one thing. I think sometimes, our PEM people, depending, they're always want to share their knowledge with everyone, but, there may be opportunities to participate in like a project or something that they might not presume you're interested in, but would presume that you might be interested in if they know that you're thinking about PEM. So, share. The other thing, I think it's good to do an elective at a different PED if you think you're interested in PEM from EM, because PEM looks lots of different ways in lots of different places. Dr. Carol, I know, isn't a panelist, but she works in the community and does a lot of really amazing work out there. So, PEM looks different in different places. And I would encourage you, before committing to, the extra year of fellowship, to, get a little bit of the lay of the land of what's out there to confirm that it's the right thing for you. And then thinking like Dr. Kim suggested about something to kind of augment your newborn skills.
Yeah, I would also add that the specific programs that you will apply to will have pediatric emergency medicine faculty. So let yourself be known and really try to get into different projects as much as possible, as soon as possible. That is, I think knowing that that's something that you want to do. So let yourself know and contact pediatric emergency medicine faculty to really get some pediatric projects going, so you can start start going to conferences like this to really get to know people, rub elbows, have your business card ready, and be ready to start calling and making those connections would be very important.
Having done the EM to PEM pathway and surrounded by peers like, why are you doing that? And it's because I loved kids and I wanted to learn more. And the EM residency doesn't provide enough pediatric time. I had maybe 3 months, my entire training. So I would suggest any elective time that you have, be sure that you take advantage of that time to do pediatrics. And the highest yield for me was the Peds ED. And the second highest yield was being on a Peds ID rotation, because you see so much infectious disease and it's really fun.
All right. Well, feel free to reach out if we can help in any way. Dr. Kim and Dr. Carol and I are all available. So thanks.
Enjoy
Thank
the
you so
conference.
much. You
Take
guys,
care,
thank
guys.
you so much. Thank you, Dr. Missman, Dr. Kim. Thanks everybody for joining.